you please WhatsApp to Mr. Biswajit Pati sir, and he will, at the end of the thing, he will declare the result, and result will come to you immediately within 1 day. Fine. So I think if people, I think that is this blueprint for living is 7 hour video course. Other one is around 1.5 hours. And the book is a book. It is a this book has got this March. It was this I got this Indie Author Championship. My book came third all over the country. So this is what the book is so important, and it is been sold in Amazon also. It is sold in all over the world. I have my students all over the world now at present because of this, and I'm also a life coach for many of the institute all over the country. So that's
all the people of our country in a different way. Today we will listen to him, and I'll just give a brief introduction about our speaker. Dr. Biswajit Mahapatra is a consultant surgeon in JP Hospital, Rourkela. He is on a mission on changing the concept of healthcare to self-health care. He is the first health motivator of the country with a vision of empowering common people with the knowledge about their bodies and mind with the aim to keep themselves healthy forever. He reveals the power of the human body and mind to people who are totally unaware of their hidden power. He has written so many books, but apart from that, the main book actually I'm just going to mention is Care for Your Health. He's a public speaker. Is noted actually some of the courses that actually help educator having courses that is platform, blueprint for living healthy, perfect health secrets, perfect nursing secret, reversing diabetes. So there are a lot of things actually we would like to hear from him, how we will keep fit ourselves during this corona period and moreover after corona period, so that at least we will not be able to go to the hospital. So with these few words, I present before you today's our speaker, Dr. Biswajit Mahapatra from JP Hospital and from also our Rourkela. Thank you. Over to you, Dr. Biswajit Mahapatra.
a very good evening to all of you. My voice is clear to all of no. My voice
So
is
you
clear.
are mute. Yes, sir.
Okay. Very good evening, all of you, and basically the Rotrax and the Rotarian of Rourkela Central. I'm really delighted that at least you people have taken a attempt to arrange such type of program, because I've been working in this field of health since last I think it's more than 10 years now. When I have what I want to notice is that whenever it comes to health, everybody tells everybody, I know everything. And there is the problem. So I'll start with a quote that is, and I think the students, for students also, it's very much important that we live in a notion that we know everything. I always say we do not know what we do not know. And that is the starting point. The moment we start learning what we do not know, the knowledge will start coming to us and we will start doing the real job. And the moment we say we know, the learning stops there and we are supposed to be there only, or we are going to, our downward journey starts. That is the most important in every field, not only in health, in every field. We have to first find out what we do not know. That is where my role starts. I want to create a awareness among people, not exactly awareness. I want to create education. I want to educate people. So how it is possible? Because education is something which everybody wants to. It has to come from the inside. I can't force somebody to read something. I can't force anybody to learn health. And see, today also we have only 9 people. When this whole community, there must be a community of around 70, 80 people in the club. So it's very practical. So I don't mind, because I have spoken in 2 people also. I've spoken in 1 people also, and I've spoken when in a gathering of 250 to 700 people also. So, but it matters. It matters the people who are listening to, they should go with the flow, they should understand. And learning, only learning is also not enough. I always say knowledge is powerful, but it is not powerful by itself. When we apply the knowledge, then it becomes powerful. Today I'll be telling you, because I don't teach much. I don't give you tips because somebody has written that Dr. Mahapatra will give some tips. I never give tips. I don't want to give you tip number one, tip number two. You eat this. I will not. I will just today I will touch, because when I talk about 7 hours, 8 hours, 10 hours, because my retreat goes for 2 days. It's 16 hours now, so it's not possible. But I will tell you where are the area where you people have to work, because you are so young. I'm really happy that at least 7, 8 people are there, and you are so young, and you can work on yourself. And the moment your health is good, the moment you keep your health, give priority to your health, and your productivity will increase by 100x. There is no doubt about it. Because if I'm not physically, mentally, or socially healthy, I don't think I'll be able to do something more in our life. And if people must be reading by now in our school and college, health is wealth, but it is just a thing which you just skip over. But it is not like that. Health is really wealth. And you ask me in my 30 years experience, how many people I've seen? I have seen multi-billionaires. They come in front of me, with the folding hand. They say, "Sir, do something. Give me something, sir." So they do something so that I can drink a glass of water. Not a single drop of water goes through their mouth. Don't you think it is pathetic? Yes, it is pathetic. I know, like, nobody can do anything to them, because they have created that. They have created that situation for themselves. And I always say, my health is my responsibility. In my book, I've given my slogan is that learn about health to enjoy your wealth. Because tomorrow morning, if people are going to do a lot of things, you are going to be somewhere in big companies, or somebody may be a big businessman, somebody may be a great scholar. It's there. But in between, if you don't learn this health, you are not going to enjoy a bit, single thing, anything you earn from your all the efforts. So this is the beginning, and it's right time that you people are exposed to such type of program. And I'll start with this today, and I will tell. I'll go on with the stories first, but let me start. Let me. Can you enable the screen sharing? I'll come with the slides.
Salamai, please.
Atish. Yeah. Okay. Document. Can you?
Yeah.
My slide is visible to all of you.
Yes, sir.
Yes, sir.
Yes, it's visible.
Sir, humble request, sir. Please kindly announce your prices so that at least everybody who has joined later that will know.
I can follow you. Yes.
Please kindly announce the prices that you have already mentioned earlier.
Okay.
So that at least all will be aware of it, and they will listen carefully.
Okay. Now for all of you, I have some surprise gift I've arranged for all of you. So I'll give 5 prizes today. And the first prize will be my course called Blueprint for Living Healthy. I'll give them access for 1 month. That access will be, that course cost around 4,999, 5,000 rupees that course cost. And it is selling all over the country just like a hot cake. And the person will come second. He will get this Perfect Health Secret that cost is around 999. And he will get access permanently for that course. And the third, fourth, and fifth person, they will get my book. This is I don't have book. That Care for Your Health book is there, so they will get that book free of cost. And this the organizers will distribute them to them. I'll give it to them. So these 5 prizes, I've got 5 questions from the beginning to end. You have to sit down, and the moment you get the answer, you please WhatsApp to Mr. Biswajit Pati sir, and he will, at the end of the thing, he will declare the result, and result will come to you immediately within 1 day. Fine. So I think if people, I think that is this Blueprint for Living is 7-hour video course. Other one is around 1.5 hours. And the book is a book. It is a This book has got this March. It was this. I got this Indie Author Championship. My book came third all over the country. So this is what the book is so important, and it has been sold in Amazon also. It is sold in all over the world. I have my students all over the world now at present because of this, and I'm also a life coach for many of the institute all over the country. So there are certain things I do. So I think you will get the benefit directly from the courses. You will know, and it will help you. So this is the course. So today I will take you to I'll go with a journey. We'll go a journey. What are the things important? Why do we think? And I'm going to talk about self care. And World Health Organization is now pushing everyone all over the world that self care is the best care. It is just they've started this 6 months. They've started this, and I've been doing it since last 10 years. I think 2014 onwards, I'm pushing this concept of self health care, and now COVID has opened up the gate for everyone. They realized that whatever I started long back, and I think now I was correct. And I want to push it further, and my vision is very big. I don't know whether when I will be reaching that big. I'll tell you at the end of the things where I want to reach my destination, because I always say your vision, your dream should be bigger than you, so that you will be afraid every day whether I will be able to reach to my dream or not. But it is my dream is so big. You will know at the end of the program what I'm where I want to go. Fine. So today it's something I'll go with them. So I'll come with my slides. The first thing I want to tell you, So first thing is, how much do you know about your body? Because if people are students and if people are studying biology also, and there are our Rotarians and others sitting here, and when I ask people, how much do you know about your body? People have got very immediately they tell me, sir, we know everything about our body, because there are certain things are being told to us from our childhood. And everybody has got their own belief system about their own body and mind. Whatever they have been taught, whatever they have listened from their parents, and I call it the information we have gathered till now, whatever the age we may be having, wherever we are, whatever profession we may be, the information which we have gathered till now are our belief
Dr.
system. Yes. Hello. Anybody wants to ask something? I request everybody should mute themselves, so that,
Yeah.
so that
Please mute all of you.
all of you should mute that, so that there will be no disturbance.
Yeah.
Because I get distracted. So that is where I was.
How much you know about your body?
So here comes the key. Every person, I believe it is not the responsibility of the doctors or the people who are studying medicine or associated with medicine. They should only know about the body. Till I started this course, it was like that. People think, why should I know about my body? There are doctors are there. They will tell me. That means when I am falling into the trap of disease, please, I'll go to doctors and doctor will cure me and he will give me health. But no, exactly that is not the right one. That belief system, somewhere we have to work on a belief system. We have to constantly learn. If you are today at studying in class 12 or 11 or something like that, you have worked hard, you have learned, and you have reached to that step by step. You reach to that, and tomorrow morning, if you want to go to you will become something else, something big. It will because you are going to learn, and you think you have a wonderful machine, one of the best machine. I think in this whole earth, if you see that at present, created by God, and we don't have any idea, and you want that we are running it, and we can run it perfectly till we die. No, nobody can stay healthy till they die, or they remain healthy until and unless they do something every day for themselves. And if you look into the life story of the people who are healthy, and you will find that they do something for their body every day. It's not that I'll do for 5 days and then I'll be healthy. People think I'll go to a health retreat, or I'll do yoga for some times, or I'll take fruit for some times, and I'll be healthy. No, That concept has to go. That belief system has to go, because our body is a sanctuary. It is just like, because if I tell you now a very simple thing, that we are made up of 70 to 80 trillions of cells. Think. And in our body, every moment, millions of reactions and the processes are going on. Now, and they are happening automatically. The mechanism is going on. And how can it's going on? Because it has been this, our evolution or whatever we are today, our cells have brought us to this stage, and we are what I say, we are what our cells are. And our cells are in a sanctuary called this human body. As sanctuary means it's a sacred place to live. Fine. Now, if you go to a temple, if you see, you go to visit Jagannath temple, there are a lot of rituals are going on, and there is not a single day, rituals have been deviated. Every day there's some. Every day they follow certain. That's why, because that is what, whenever there is a sanctuary or there is a sacred place, the rituals has to be maintained. So similarly, this is a body, human body. This is a sanctuary where 70 to 80 trillions of cells are living. When I talk about this cellular health, because this is what the future is. When I talk about cellular health, you know what I talk about? I make them visit the sanctuary. How wonderfully this sanctuary is being made. Fine. So, but for you, let me tell you. So we have to create rituals for to give respect to this human body, because this is not less than a temple. I go to a hospital. I think my hospital is a sanctuary, and I do everything according to the need of the rules and things. You go to a school. School is a sanctuary for you. If you do everything perfect, then only you will be able to do the things, and you will grow out of that. Fine. Similarly, for human body also, we have to do that. This is what I want to tell. That's why my first question always comes is, how much do you know about the body? And I tell you, 99.9% people do not know much about their body. Not even less than 1%, I can say. But they consider themselves that we know everything, because there is a notion called information and misinformation. Right? And there is a very thin line between these two things. Very thin line. And we do not know when we cross this thin line and we stay in that misinformation part, and we spend whole of our life on that part. We never knew we were in the misinformation. We are on the misinformation platform. So here you have to differentiate between this. What is a information and what is a misinformation? If you understand that, if you can, because today the informations are at your fingertip. Your mobile gives you thousands and thousands of information at every moment, and you think these are all correct. You switch on the TV, you switch on the video, any video you watch, you are going to have all these things. But now it is your duty, it is your research work, your learning, which will make a difference. And the difference is for you only. And I'm not bothered about everyone. I am bothered about myself. So I want that you should bother about yourself. And you should find out what is the good information for you. That I will tell you. Fine. So before I start, I tell you why I'm in this, why I'm sitting out here, and I have been talking to all the people all over the country, all over seminars all over the country. Why I'm here? What makes me, and why? So I'll tell you a very simple story. There was a wise man. He was living in the I think Himalayan valley, and he had created a lot of students. He has produced a lot of students. He had a big ashram, and he had millions of students all over the country. And he was dying now. His last time had come. He knew he's going to die. So all of his disciples, they had come to visit him to say goodbye during his last time. So everybody were waiting what their guru is going to tell at the last moment. What is their last word? Everybody eager to wait. They were eagerly waiting that what he will say before he leaves this earth. Now, with that time has come, and that wise man opened up his eye, and he looked around the students. He looked all around his students, and he told, "See, I've trained all of you whatever I knew, and I know that I don't have anything more to give to all of you. But I am also sure that whatever I've taught you, very few people have practiced those things. And but I don't have any more time to teach you people more. But my time has come. I have to go to the other shore. So, but I can give you a chance. Anybody wants to come to me, come with me to the other shore, can come with me, so that you don't have to learn anything more, and you will enjoy the heaven. So this is a offering. I'm giving it to you. Now he was looking at all of his disciples who will say yes to come with him. So now there was a pin drop silence everywhere. There was a pin drop. Nobody. Everybody was looking at the other person that he will say yes. And everybody started looking at the chief disciple who was serving him since last so many years. He also didn't tell anything. And the wise man was about to close his eye. Then somebody raised his hand from the behind. He said, Guruji. Then he told, then the sadhu looked at the person. He was one of his old disciple. He started feeling, oh, let me see, one person is ready to come. But before he could tell anything, the disciple who raised his hand told, Guruji, let me clarify from the beginning that I am not interested to go to the other shore with you, but I have a request to you. And the wise man told, what? And see, I don't. I have a lot of work to do. My daughter, I have to get my daughter married. I have to make my son established his business. I have to, and some of my guests had come to my house, so I have to look after them. So I don't. I'm not yet. The right time has not yet come. But I'm promising you, teach us again some. You give us some tips so that we can remember it. And once the right time comes, I will come and meet you in the other show. Dear friends, why I'm telling you this story? Right time never comes. This is what I always say, right time never comes. This is the right time. This is what I'll tell you. This is the right time to prepare ourselves. Right time never comes. That's like we always think that disease will never happen to me, or I'll do exercise from tomorrow morning. I'll take care of it after my daughter get married, or my exam is over, or I finish my subject in due course of time. I'll start doing exercise. Surely I'll do the next week. And we always say, when the right time comes, we'll do this thing. We'll take care of our body. And dear friends, it never, never, never comes, because tomorrow never comes. This is what the story tells us, because there is such a great opportunity this wise man was giving to their students, but they thought we will do it later on. Now, so to get the advantage, to get a good health, we have to walk the extra miles. We have to do something for our body, do something for our mind, do something for our where we are living, our environment, where we are staying. Because health definition, if you see, people tell, if everybody tells, I'm healthy, I don't have pain, I don't have fever, I don't have a disease, so I'm a healthy person. Like because you are students now, the Proteans, you must have seen that many of their friends, they met in the evening, and the next day morning, they've listened that the patient had a heart attack and he died. That means what? Does that mean that the person who died in the night, he was all right, or he was healthy till the next one day before evening? One day before? No, he was not healthy. He had problems because health definition has changed in between. Since long, we define health in a different way. We tell it in the physical, mental, and social well-being. We have to balance. We have to keep a balance about that. And that is what the need of the time, need of the hour. We have to do that. Otherwise, we can't do anything more. We can't help, because the time comes when suddenly one day we find we are in a soup. We are in trouble. So we have to prepare ourselves for a healthy life. Now, what do you mean by that preparedness? Are you prepared? Now, let me ask you a question now. Are you prepared for are you preparing yourself, or are you prepared for that? Now, see, what is that preparedness? I always say, preparedness is nothing but preparing with the end in mind. I always say preparing means with the end in mind. You should know where you will be after 5 years. what type of health you will have after 2 years, 3 years, 5 years. So here the role of goal setting comes into the play. Age you have your own goal for your examination, age for a career goal. So here comes the health goal, preparing with the end in mind. Where you want to be at the age of 50, where you want to be at the 25, at what type of health you will have at the age of 30, at the age of 35, 40, 50, 51, 55, 56, 70. So we have to think in advance. We have to keep in this. Without that, we cannot move, because nobody I met. I must have seen patient in lakhs. I must have operated patient in thousands and thousands. I've never seen anybody had this health goal. What is health goal? If I ask you, is there a goal like that? Health goal? Yes or no? Nobody. Nobody bothers to have a health goal, because we take it for granted that this body is immortal. Nothing will happen to me. This is the biggest thing I always say, and this is the biggest mistake we do. It is not to do with any age, from you can say 12, 15 to 90, 100 years. Everybody should have a health goal, and that's what I want to teach this people, students. I always say, now you are in such a young age, and every functions of your body organs are wonderfully well, and if you go on respecting your body, and that's what I will come later on, and you think that you will be healthy, want to be remain healthy forever, you have to work and start working from now, and no disease will never touch you. This is guaranteed. So now it comes a preparedness. Now, when it comes to preparedness, now I'll ask you, what is preparedness? Now there is a question, and everybody thinks that preparedness is something very. When I will prepare for tomorrow. I'll give you an example. I'll give you an example through which you will know. Sound coming somewhere.
So sound is coming, sir.
Sound is coming. Okay, no problem. People think, what is preparedness? So immediately when I ask you, people get confused. Preparedness, what is that? It's a simple word. It is a very simple word. No, it is not a simple word. It is a very dangerous word. Let me prove you how. Fine. Now, look into this. Do you remember this ship? This ship is Titanic.
It's the Titanic.
Titanic. Now, why I am showing you a Titanic picture? Now, that you must be curious. You must be curious enough, no? Why I am showing you in a health program like this? Because everybody knows about Titanic, that it was one of the most beautiful, most expensive, and it was the best of that particular time, having the best of engineers and the best of crew that were richest. The ship started with the richest crew of that particular time. All the crew were the richest person of that particular from England. That was, I think, it was going from England to America. Fine. So why I am showing you this is, and this is because everybody knows that it got it shrink on the next day. I think after 24 hours of its journey in the mid of the sea, when it collided with the iceberg.
Yes.
This much you know. But today I will tell you the other aspect of the story. What is preparedness? What mistake these people have done? How the things? And you'll be surprised to know that the captain of the ship was one of the most experienced captain of that time. Fine, because it was the best of that time. And I think that was the ship of that time. And you can see these are the decks. The Titanic had 16 decks, and each deck had the capacity to hold 4 lifeboats. So think of 16 into 4. It had a capacity of 64 lifeboats. And that day, the day it was about to start, that the ship was full. There were 2,100 people were traveling that day. Fine. And it was supposed to start at 10 o'clock morning. And before, I think half an hour before the ship started, somebody came with a news to the captain. He told, "Captain, we have a problem." Then he told, "What's the problem?" Then the person told, "See, till now we could only load 16 lifeboats over there. Rest are coming. It will take another 1.5 hour to 2 hours to reach, and so that we can load the lifeboats and we can move on." Then the captain was, by the time, he was very much euphoric. He was thinking at the time, and he told that person, See, nothing will happen. This is one of the best ship. All the safety equipments which are there in the ship is one of the best. Nothing will happen. And I can't, 16 are there. I can't wait. This is the first journey I want. I don't want to be late. So he didn't listen to that person. And they started this journey without 64 lifeboats. They went with only 16 lifeboats. And the next day night, I think, it colored it and the ship was sinking. Fine. And that time the captain was thinking. He might have been because he also died in that. And that day he was thinking, why I didn't wait for some more time? Why I didn't allow those 64 lifeboats to be there? Because only 700 people that night were saved because of 16 lifeboats. Suppose there would have been 20, all 64 lifeboats would have been there. Not a single person, including the captain, would have been killed that day. And this is what the preparedness is. We have to think, we have to prepare ourselves, we have to arm ourselves with all the things needed for a good health. From the beginning, not that when disease strike us. When the disease strike us, that time we were just like a captain, shrinking. We do not know whether we'll be alive or will be dying. Don't you think? Am I correct? This is what is
Yes, sir.
preparedness. Preparedness. That's why I thought this is one of the best example I can give it to you people. What is a preparedness? It can be applied to everywhere. For exams, for your interview, for your health, everything you take up. And if you remember this example, and you will think, because we always think we know everything. I have a wonderful body. I am the best. I'm taking care of it wonderfully well. But when you ask that whether I am doing it, really I have everything with what is needed for my body. If you ask that question, I think you will start preparing yourself for the next thing. So, ladies and gentlemen, this is what my book is, Care for Your Health. This has got, I think, this is the Indie Author Championship. I came third. Unfortunately, I was aiming for the first, but I couldn't because fictions and all these things, they're very, that sale was very high. But I could, this is the first time a health book has come into this type of championship. It become in the, in this first three, I come the second runner up. So I always say that I never thought okay, one day I'll be writing this book. It is not also a part of my education. My education is to treat diseases, and my education has never been to talk to people about health. It has happened because of my own problem. One day I had a problem long back, and to overcome this, I started learning health. I found that health is different and disease is different. I'm a very good disease care professional. I'm one of the best disease care professional you can say, but I was not a very good healthcare professional. I was not knowing much health. If I didn't have the knowledge, how can I expect that you people have knowledge about your health? If you tell also, I'll deny it because I had learned. I learned for years. I'm learning, still learning. I'm still learning about the health. And this is where I always say, I did the first thing to come into the stage is that I started unlearning many of the things which I've learned. I started unlearning. Remember this word, unlearning. If you want to move forward in your life, want to stay healthy, want to be something else, you have to start unlearning many of the things which you have learned and you have to identify them. What are the things I have to unlearn? And that is the biggest difficult and it's a challenging thing for you. And if you overcome that, you start unlearning things and you are starting to relearn the things which are going to help you. And this book is a product of unlearning and relearning. Fine. This is what I always say. So let us come to the topic. So this is the topic today I'm going to discuss about practicing self-health care. What is that self-health care? Why it is so important? If you go through my last few 30 minutes, if what I'm talking about, it is indirectly leading us that we have to learn, we have to practice everything on ourselves, and all over the world. This practice is now World Health Organization going to pushing everyone learn, work on yourself. So this is nothing but how to take care of yourselves. This is Very. So it is. I always call this is the art and science of wellness. Fine.
Please, excuse me, everyone. I request everyone kindly mute yourself. It's disturbing our speaker's talk. Actually, I humbly request all of you.
I think
Yes, sir.
Nanda,
Carry on, sir.
you can mute everyone except me. Fine. So
Okay,
this is just like a art, and this is science of wellness. I always say, modern science, modern medicine, or which we call. I have a notion. Somewhere I've learned in my last 30 years that modern medicine, or we call this medical science, is not a science, but wellness or our human body has got a science. But what we do, what the modern medicine is telling, it is a observational science, and it is only will be able to. It will cure 70 to 80% of people, and something will which works for someone, it may not work for the other person. So, but a health or the wellness, it's a body, it's a biology. Biology never say anything wrong or anything something which never changes. Fine. So whatever thing we are going to feed it to it, it will do the things. So it is a, something like an art, just like an art. We can always learn about it, and the science we can always apply the things over our body and do wonderful things to ourselves. So this is what I always say: staying healthy in mind and body is essential. I think it is somewhere. Atish, you mute everyone.
Yeah, you mute.
Atish, you have
Sir, I'm
you
not
have
the
the
host.
capacity to mute everyone.
Salam bhai, please mute
Sir,
everyone. Please mute everyone.
sir,
Salam bhai.
Dr. Viswajit is the host of this meeting.
Make me
Okay,
myself
Dr.
host,
Saab.
so I will mute
Yes,
everyone.
sir.
I'm the host, no?
Sir.
Yes, sir.
I can do that.
Yes, sir.
Where to do this?
Yes, sir.
Sir, just right click on the participants and then an option will come up.
This invite option is there only. Okay. Mute all. Okay, I'll do this. Yeah, I've done it. Thank you. So now this is better. So staying healthy in mind and body is essential, especially in this current state of the world. Don't you think that? That is the thing. If I'm not wrong, this COVID has taught us a lot of things. And I'll tell you my experience in this COVID situation. I used to counsel people that doctors normally used to say, what? Your patient will be all right. But this was the time when I was counseling my patient, your patient will die. Accept it. See, where was what type of role I was playing, and it was one of the most difficult part of my life. I'm telling somebody he will die. It's because those are the people, they created this thing for themselves. And if you see the statistics, this has come to people who are mostly neglected. If I have seen most of the people, I have talked to them, I've visited many in thousands, and I've seen that these are the people who have never taken care of their own health. It is now very essential. Each and every person. My aim is that if I can do something through the courses, through the seminars, through the things, if I can reach to them, and at least I can ignite their mind that yes, you do something, I think that will be a great thing for me. Right? Taking good care of ourselves can help us moving from simply getting through the thriving and growing during this unusual time. We will be doing something great in between. And the moment you start your journey towards health, you will be a different person altogether. You are a different person. You are not the same person. I always say, because I have traveled this particular thing. So what is self-health care? Now let us come to self-health care. What is that? It's a very simple thing. Self-health care is an activity we actively choose to do to take care of our physical, mental, and emotional well-being. I told you in the beginning, this is not only physical. Somebody talk about, see, when I was in 2012, right, 11, no, 2010, when I had a problem, I was trying to reorganize myself. I started asking myself one thing: what should I do from tomorrow to keep myself healthy? That question came to my mind, and one evening I sat down with one pen and paper, and I started thinking what I'm going to do from tomorrow morning. And I was thinking, I was waiting, something should come to my mind. I was looking, searching the net and everywhere. What are the good things? And I was confused. Somebody was telling you nutrition is good. Somebody was telling you yoga from tomorrow morning. Some of my friend told you start taking this, go to the gym. So now multiple variation of one thing. I was surprised. I was telling I'm a doctor. I've studied medicine for around 10 years. I've been in practice for 12 years. I'm the best surgeon of the city. And I'm asking a question how to lead myself to a healthier way. I don't have an answer and I'm confused. So then I thought, no, let me learn. It is not one thing. Fine. It is every in a holistic manner. In a holistic means as a whole, I have to take care of this mind, body, and my emotions, everything. Then I started learning. And whatever I speak or whatever my courses are, it is all based on those learnings which I have learned. I am passing on because it has worked for me. I always believe, and I forgot to tell you, I am a NLP certified trainer. NLP means neuro linguistic programming. Fine. And I always advise people to go for this type of training. I'm the only one doctor, I think, who has been certified by this neuro-linguistic programming. There we say one thing, if it has worked for one person, it will be working for everyone. And I give a very nice example for that also. You know why? What type of examples? You must have heard about Roger Bannister. Roger Bannister, in 1958, he broke the world record of 4 minutes a mile. What was big in that? Till 1958, the concept of physiology or the heart physiology or the things, the exercise physiology was that if somebody will do this much thing, less than 1 miles in 4 minutes, then his heart will burst of the pressure it will generate. But Roger Bannister did it in 1958, fine, in the Olympics. Now, the question was why I'm telling you, which is not so big. Somebody breaks the rules, a new record, they make a new record. So it is not important that Roger Bannister did it in 1958. The interesting part was that within next 6 months, there were 28 people who did this 4 minutes a mile. So the question was that what was making these people, other people stopping, what are making the people stop to do this thing before? But once they know that somebody has done it, everybody started trying, and 28 people, until now, there are more than 60,000 people have done this 4 minutes a mile. Don't you think it's interesting? So that's what that thing came to my mind. If it has helped me, it will be helping everyone. Only thing is that they have to follow the same principles, same tricks, same thing which I have learned. And it is not I have learned. It is not that I am telling you something. It is what science is talking about. What was the learning part of it? I have learned, so you have to learn. There's nothing it comes to us automatically. Nothing will come to us automatically. We have to learn. That is very important. Fine. So I always say, why do we need to practice self-care? What is the need of this? Our well-being is important no matter the circumstances or state of whatever may be the circumstances, whatever may be the matter. We may be a great businessman, we may be a great doctor, or we may be a prime minister of the country. Doesn't make. Health is for everyone the same. The definition of health is same for everyone, and it was if you talk about 2000 years ago also, the definition of health was same during Ayurveda and all these things. Those time also the definition of health was same. Now also same, and it will remain same for next 100, 200,000 years also. But the definition of disease is changing every hour. Every month you find a new disease. COVID was nowhere there. It had come. It has killed thousands and thousands of people and it killed millions of people. Where was COVID before? So definition of disease changes every moment. But when we talk about disease, there are so many things in a disease. Disease care means you have to do so many things. But when you talk about health, it is only and only one thing. So don't you think the difference? It is better to go for multiple things to take control, or you will work only for one thing, which is easier. And think, going towards health and preventing from diseases. Now, two words come. Some people talk about prevention of diseases, and I talk about going for health or promoting health. They're two different words, right? When we try to prevent diseases or reverse diseases, we use a lot of energy not to do that, not to go for that type of thing. We use a lot of energy for this. But health is a nature. It's naturally we are born healthy. So when we think of health and we want to go for health, our flow is very smooth. we have to put very less effort as compared to preventing or reversing or working on a disease. So that is the reason why I always say self-care is very important. Because self-care means self-love. We have love. I will come there. So self-care helps us to manage stress better and allow us to be more productive. Taking care of ourselves helps us keep good work-life balance. It is for the students I talk about. If you are healthy, you will be able to give justice to your studies. And if you have problem every day, every year before exam I get around 10 to 15 cases. I'm talking about myself. Before exams, they come with a lot of stress. Somebody come with the pain. Somebody come with vomiting. Somebody come with the things. They are not prepared because they have never maintained those things. So they miss. So their education get hampered. Fine. So now, what are the areas of self-care? Now, this is the thing which I'm going to tell you. This is open up a mind. What are the areas of self-care where we have to work on? We have to work on the physical part. Fine. Tending your physical body and keeping it healthy. One part of this out of this four, one part is your physical work, physical body. The second part is your mental. How or mentally we are doing. Tending to your mind by practicing mindfulness and learning. These are all things which I teach in my courses. One is this emotional part. Like we are emotional beings. Human beings are nothing. And if you see that our emotions changes our body physiology. The moment I'm angry, my physiology is different. My heart starts beating in a very fast rate. My body goes into a fight and flight mode. My body automatically goes into a fight and flight mode. When I'm happy or I'm peaceful, my body goes into a different mode. That is called rest and recover mode. See how important this thing is. Can you understand? In one state of in a state of peaceful, our body goes into a rest and recover. Body goes to recovery mode. It start rebuilding us. But when you are angry and when we are in a mind where we are in a different mood, fine. We are in jealousy or we are in anger. We are in something like that. So whatever our body goes to fight and flight, all of our energy is been because in that mode goes to the periphery. Like our muscles get ready for fighting and our intestinal organs, the central part, get very less. Our brain get very less blood supply because body is in a fighting mode. So there, our decision-making capacity goes wrong. There, we don't do we take the proper decision. Our digestion goes in a hayward. Right? So just think, the simple mood, simple emotion can change our whole body and mind. Fine. This is the things which I teach people. And social. Social means where are you staying? What type of environment? What type of friends you have? What type of people you are meeting? And there is a saying that wherever a person, if we have to predict where one person will be after 5 years, physically, mentally, and socially, it depends on two things. It's only depends on two things. It's how many people you have met and how many books you have read. Remember these things. The person, it will change your journey towards a different, because the person who reads and who meet a lot of people in his environment is better. His scope in future is better in all aspects of his life. So this is what I always say. So wherever you will be, it will be decided by the number of people you meet and the number of books you have read. So start reading. Your textbook are okay. You have to read your textbook. Then with that, you have to start reading a lot of books. Lot of books. Somebody told me recently, when I was pushing my book for this contest, I was writing letters to, I must have written letters to more than 10,000 people. Because this book competition, you have to show your sales also. And somebody told me when I was taking in, why don't you do this? This is a health book. He told me, sir, आजकल किताब कौन पढ़ता है, sir? I was telling, see, don't buy my books. I don't tell you, but don't tell these things. because this is a very influential person. Suppose someone tells कि आजकल किताब कौन पढ़ता है, then it is a foolishness. Because these are the landmarks, these are the things, and we have to promote them. We have to promote. See, promoting something is very important, and that too. So, book promotion somehow it has. In my last 3 years of experience, I tell you, like how difficult it is to sell books or how to make it reach to people's hand. I have to give my book free of cost to 100 places just because let somebody read, let somebody do the work, let somebody learn something. This is what. So I have to push somewhere, but it has to come through a multiple angle. Everybody should start reading books, and especially students. I always request you start reading some good books. Something in a week, at least read one book. I read at least. I think till now I read. I think more than 3 to 4 books in a month. My son, who is 21 years old, I think he must. I have a library in my house. It has got more than 1,000 books, non-fiction. All these are non-fictions. So he has started. I think he is 21 years old, and he must have read more than 30% of books. And the way he talks now, I think he's more learned than me, because that at particular that age, at this age, if you start reading the books, no, you will gather more information. Your mind will work more, and your vision will widen, and that is the need of the time. Because you are not reading, because you are stereotyped, our vision becomes less, and so it in health also, in mind also, everywhere we are limited. And don't make yourself limited. Expand yourself to the maximum. There is no limit. At the age of 55, I think I don't have any limit. I want to reach to a place where nobody can reach. I think like that. Age is not a bar. My wife is now 50 now. Has gone for a post-graduation course. She's studying just like any student. So there is nothing wrong in it. Age is not a criteria for reading. I always say this is very important. So physical self, and that I'll touch because it's, I think it is time. So should I continue for more, or you are bored? Okay. So now physical self-care, I'll touch everything. You should know about your biology. What type of you are made of, what type of things, what your cells has got power, what type of power. You will be surprised to know that your cells are more hundreds and thousands and millions times more intelligent than you. Your cells are more intelligent than you, and they control you people, not we control our cells. This is the reverse. Let me tell you one thing, and the God has given our cells the power, not to you. Our heart functions by itself. Our liver functions by itself. All the important organs, they manage by themselves. They are not under our control. Don't you think? They are not under our control. They function because they are more intelligent. They know what to do. At what time they will beat and what time they will slow down. They know everything. And they depend, and their work, it depends on all the information we put inside our body. Fine? And you should know about your physiology. Like here, maximum people, they fail. People tell, I am walking for 10 kilometers. I walk for 5 kilometers. I do exercise every day. But those people, they don't know the physiology because nobody has told them how you should walk, that it will help your body, how that type of exercise you will do so that it will help you. So exercise is a science. So you have to understand the exercise physiology before you go for that. That's what I teach in my courses. Nutrition is one of the most important thing. Nutrition is one of the most important thing because, our body gets energy from two things. One is the oxygen we inhale and just a minute. And the food we eat. So our food culture has changed. And you will be surprised to know that in Indian, food is one of the best, or one of the best balanced diet we have. Every plate we eat, in our culture, is one of the best. It has got carbohydrate, proteins, and fat. Everything is there. But we have gone into the fast food culture. So that is the reason why in the last 50 years, India has become a diabetic capital. It has become a hypertensive capital. It has become cancer capital. What not? It is one of the reasons is this nutrition. And we have a lot of myths. And that, because whenever time we'll discuss on that. But remember, this is one important thing. And you should understand your energy system. Like many patients come to me and they talk to me about, what? They say, मेरे को weak लग रहा है, कुछ दवाई दीजिए. And they forget because nobody has got idea. What is that weakness? Weakness means kya? We don't have energy. What is that energy? Where from it comes? And you will be surprised to know that we have energy factories inside our cells. We have energy factories. And the factory, what we call generators, we call generators, that generate our energy every moment. And the fuel for this energy is our oxygen and the nutrient it goes. Then that factory produces the energy and that goes and gets stored in this called a battery. We have got rechargeable batteries. That is called ATPs. So we have everything in our body. Your battery is not getting recharged. So you are feeling weak. How you will recharge it? Go and move on. Your car battery starts charging when your car moves. So inactivity is one of the cause of weakness. So because you do not understand the energy system, you feel that I have to take a medicine to get energy. I'll get a medicine, I'll get my immunity. It's all bullshit. Nothing. It never works. It's all marketing gimmicks and the science never advocate that. And I'm a science person. I always talk about science. You can generate your own energy with taking proper step. What should you feel? Because if you have power to generate your own energy, if your movement will create ATPs, your movement will supply energy to yourself. Your battery will be stronger. Your factory will produce more. Then why should you feel weak? You will never feel weak. Right? You have to understand this balance. Breathing science. Breathing science means we don't breathe properly. There was a study done and they found 99.9% people, we don't breathe properly. Whatever we breathe, it is sufficient to make us alive, but it is not sufficient to keep us healthy. Right? So here comes the science of breathing. That is, pranayama is one of the best way of learning breathing because this is called deep breathing. So you have to understand why. When I'm shouting at somebody, when I'm talking to people, I'm not taking full breath. My breathing is now shallow. So what should I do? I will find out some time to have a deep breathing exercises. Maybe after this, I'll go for 5 minutes of deep breathing. It will supply my energy. Fine. So these are small tricks, nothing big in this. Fine. And okay. Just a minute. Another one is science of nutrition. Okay. Now, let us go to this. Self-care also means being patient and kind to yourself. When you start taking self-care, you will be very much kind to yourself. We are not kind to ourselves. If I ask you, are you kind to yourself? Have you done everything for your body today? Have you supplied the things to your body today, whatever it needs? And 99% I'll find no. You are not kind to. You have done something more or you have abused your body. We abuse our body every day, every moment. We in a rush because we are living in a fast-moving world. And how long will rush? Somewhere we will fail. Today, I'll give you example. Today's example. Since last, I think 3 months, I've been asking my orthopedician to slow down. He's only 38 years old. He's operating from morning to evening with a thing. This 30, like in 40s, he's very enthusiastic and he's operating like patients and anything from mornings 9 to. I told him, don't do. Plan it out. And today he came up with the report of he has developed diabetes at the 38. None of his parents are diabetic. He has created that sin for himself because he was not kind to himself. He was kind to patients. He was kind to the hospital. He was kind to the other people. Not kind to himself. What is this life? I realized that one long back. I was operating 17 hours, 16 hours. And what I got? Nothing. I got a ill health. It is not. So I have to be kind to myself. I have to give time to myself. I have to love myself. That is what the need of the time. Why can't I love myself? What must? And once upon a time, I also think if I don't operate, the patient will die. And the day I decided I'll operate only 2 cases a day, and I started refusing patients, none of the patient died. They go and they get operated by somebody else. So what? I become kind to myself. I started loving myself. That's what I need. That's what I need people to do. Fine. And mental self-care means you have to understand your psychology. What is a health psychology? That is what I am talking about. You have to change your belief system. Our thoughts, emotions, behavior has to be, you have to work on this. Because these are all things you have to learn. What is a thought? How thought creates emotions in our body. And our emotions create the behavior which you are seeing, which we manifest. So all these things has to be planned out. You know what is the subconscious mind, what is the memory, what is concentration, what is conscious and this conscious and subconscious mind. I always say you will not be knowing anybody else of you that we are being run by our subconscious mind. 90% of 5%, 95% of behavior or the thing we do, it is been run by our subconscious mind. It's a programming which has been made before. And in NLP, we work on that subconscious mind. We change, we work through our conscious mind and we work on a subconscious mind to lead a different life. I can change people's circuit, this mental circuit, fine, once they work with me. Fine. So this is what is the important thing. And there is a called brain gut access. What is that brain gut access? You must be feeling sometime when you are hungry, you get a lot of anger, you are angry. Your behavior is different. When you are full, your imbalance. What is that? Why we feel that? It is because we have a second brain. Nobody has told you this. We have a second brain that is called our gut. Gut means our intestines. Our intestines are our second brain. You know the number of nerve plexus in our brain, it is, and the number of nerve plexus in the abdomen, in our gut is almost same. And there is a direct axis that's called brain gut axis. We have direct correlation between these two. And we do not know about that. So we abuse our abdomen. The moment we abuse our gut, our brain get abused. Our behavior changes. Right? And nowadays, it has been, and we have in our intestine, we have called very interesting thing I'll tell you. We have got a microbiota, or we can say organisms, fine, which does wonderful job for us. They increase 90% of immune cells are produced from there. And that is, then they control this brain gut axis. And with the fast food culture, we are killing those bacteria with antibiotics and with a lot of medications, with a lot of food. They are getting killed. They are depleted. The moment they are depleted, we are in a different mood. We are in a different person. We are different. We are having diseases and all these things. Fine. And second thing is, when I take a mental self care, I talk about meditation. So meditation should be a part of our life as exercises. Stress, we have to embrace stress. I talk about the science of stress, that is called embracing stress, so that you can use stress not as a obstacles but as a stepping stone. So my program is called Embracing Stress. It's a 1.5 hour program. Fine. And I call cognitive neurosciences. We have to understand that science of self-love. How can we love ourselves? It is a science. We don't do it. And I give emphasis on this. I teach people. People tell me, sir, you are making me selfish. Okay, no, I'm not making you selfish. Because the moment you do this, you take self-care and you start loving. So what is self-care is something we enjoy doing and not something we feel forced to do. So whatever, I always say, if I force you something, then that is not self-care. If you adopt these things which I told and start doing it, that is called self-care. So self-care practice can look different for everyone. And for every person, it is different. The thing which you take care, the way you will take care is different for you also. For everybody should have their own way of doing it. Only thing that you should understand that, and that is what is going to make you difference. And I always say about emotional self-care. So we have molecules in our body which controls our emotions. That is called like endorphin, which is that is called that is a chemical of whenever we're in stress or we're doing exercise or with tolerance. This is called endorphin comes in. We have serotonin. Like I talk about those things when I talk about this emotional, because we have a control over these molecules. We can generate the molecule according to need if we want. And we have to practice this gratitude, affirmations, and prayers. And you will be surprised to know that prayers are being inducted into a lot of hospitals in Western world. In America, there is a hospital, and the moment a patient, they have done studies also on this, how prayer works. They used to get a lot of trauma patients, and those patients used to be hopeless cases. So there were a lot of death in this hospital because the patients were used to come in very late. So somebody has introduced them to the prayer. So what they did, this is for a year or so, what they did, they created a system. The moment a patient used to come to that hospital, they used to feed the name and age and his location, and they used to send it to different places like to mandir, mosque, and churches. And they did it for 1 year. And in those places, people used to pray for this person in this particular time. And they found after a year, the death rate has reduced by 47%. And it was eye-opening for the modern medicine people. And this is called non-local healing, or this is called the fourth era of medicine. Right? We all are heading towards the fourth era, but in India we are still in the second era of medicine. But in Western world, they have gone into the fourth era, that is called non-local healing, how prayers also helps in healing. Fine. So in social self-care, I always say that is lifestyle. You have to understand the lifestyle. That is, I always talk about the epigenetic lifestyle modification. Epigenetics is that we can change the coding of our genes. Some belief is that whatever is written in our genes are not changeable. Right? If I have a diabetic gene, I will be a diabetic. That is what the normal people believe. Now the epigenetic science is talking that we can change our coding system. It's a good cell become a cancer cell because of our lifestyle. We can bring it back. That is called reversal. We can bring it back to the normalcy, and we can be a normal person if we work on that. And not only that, the science is proving it. And I forget the name of the doctor. There is a cardiologist in America. He did a lot of experiment on this in the 90% and 100% block arteries. He took two groups of people, and in one group he advised them that all the things which I am advising you, and in the second group of people he had practiced them. He put them in a different environment. He taught them yoga, then nutrition and prayer, all these things he started with these people. And after 3 months, they did the study. I have a photograph of that in my programs. I show them. And they showed the photograph. They took the photographs. They found that the 80-90% of blocked arteries are opened up in this control group. So it is possible. Everything is possible. Only thing you have to understand. You have to learn. You have to learn the techniques. You have to learn the way it is being done. You have to believe that this is happening. Because you have to expand your knowledge. Because our not teaching profession, or you can say the way we are going this education system is making us tunnel vision. We doctors, I always say, we doctors are very much tunnel vision. We have been trained disease, nothing more than that. Fine. Now when I'm coming out, I'm expanding myself. I found that a lot of things to learn. There's no ending. Fine. And I always say, you can also think of self-care as taking care of yourself so you can better take care of others. This is a question when somebody will tell you, are you selfish? You tell, no. I answered myself the time that if I can take care of myself, then I'll be of help to millions of people around the world. If I'm not taking care of myself, I'm useless. I'll be finished. Exactly the same way you have to do that. You have to think, if you take care of yourself, and you will be helpful to millions of people who need your help. And people need our help. We are in need, but we don't think. If I'm not doing it, my knowledge, I always say, I have a slogan for this, for doctors. Actually, I'm now using that slogan for doctors. I always say, earn from your knowledge, serve with your skill. The moment you start earning from your knowledge, your skill can be given free of cost also. And you can sell your knowledge 100-fold also. People are there to buy your knowledge. Fine. People are there to buy your knowledge. My courses are being sold. It's my knowledge. I'm selling my knowledge. I know. I don't have to. Knowledge I'm selling. And I take this program. My program charges are 10,000 rupees per hour. Can you imagine that? And you are enjoying that one free of cost, because this is our own city. Right? This is because of our relationship. This is that. So because you can earn from your knowledge. But the moment you learn from your knowledge, your skill, you can give it free of cost. I can treat my patient. The moment I will be self-sufficient, I will earn more from this. I may not charge for my patients. I don't care. This is what, because that is the thing you have to learn for your knowledge and do that. So it is the last slide. So learn self-health care to enhance your productivity. And thank you for listening. And this is the thing I want to show you. This is my vision. And this is the institute I'm dreaming of, the Institute of Medical Wellness and Research. And let me tell you my dreams. And this is supposed to be in 100 acres of land. with a wellness institute, with a health retreat, we can say resort, and all the world's healing hubs will be there. This is a 1,000 crores project, I'd say. And I'm trying for getting it into everywhere. I'm starting from PM to CM to everywhere I'm charging. Even I have discussion with collectors also. And I've been going to many of the chief ministers. I've visited Jharkhand chief minister also. I want land, I want money, I want thing. I know money is not a problem. But the concept is I want to create a category of professionals that is called 4-year courses and BSc and health and wellness. That is, which will cater only health of people. They will not treat diseases. They are not Ayush. But here, health, like in these courses, we will be teaching them everything: anatomy, physiology, biochemistry, psychology, even what do you say, those Ayush, some part of health of the Ayush, then meditation, yoga, everything will be taught. And these people will be a single piece will be there. Because my plan is if I can establish by 2026, the 30 will be the first batch will come out. So this is my 4-year plan. On that, I'm trying. I don't know how far I can go, but I'll be going. Every day I try something for this, and one day it will be possible. And this will be done under the there is a trust I have. There's a global self-health care education and research. So we'll be working on cognitive sciences, neurocognitive sciences. All these things will be research will be done. I don't know where it will be, but one day. So thank you very much for this, giving me time and all these things and listening to me patiently. Any questions I can take up?
Thank you, Atish and Kiran and Ravi bhai. Please, if anyone is interested, Jyoti, आप लोग कोई अगर क्वेश्चन सर को पूछना चाहते हैं,
कोई भी क्वेश्चन पूछ सकते हैं।
बस प्लीज सर, पहला क्वेश्चन मैं पूछना चाहता हूँ।
Excuse me, sir.
Yeah.
Greetings of the day. I'm Parnava Sengupta from class 10F of DPS Chaukala. First of all, I would like to thank you for sharing the immense knowledge that you had. Actually, in today's day, we really need it. We really need it. So secondly, I have a question for you. That is, in today's generation, you can see many students are suffering from myopia. That's a common problem nowadays. Like you can see out of 2 students in the 5 group, some or the other person is wearing glasses or specs. It's sometimes pretty insecure for the one who is having higher power. Like you can see, even I'm suffering from it. People usually have -4, -5. The kids nowadays are having. Like in the beginning of the session, you told that you usually don't give tips. But after getting fascinated from your words, I actually want some tips from you that you would like to give to students like us who are suffering from this problem. So please.
First of all thing is that the biggest problem we are facing is the screen, this mobile and laptop and everything. And that is giving you stress. Because here, if you are having something, remember one thing, you have the power to stop it at that particular level. And there are, long back, when I was doing my NLP, that time I had come across I don't know how it works, but it was working with worked with some people. They used to have there's a spectacles, there is a small holes are there. One scientist has made it and it is given to me. I've lost some it somewhere. But if you start using it 1 hour a day and your ocular muscles, there are some small muscles are there, that will get strengthened. First of all, you have to avoid this mobile screen time, make it as little as possible and start doing eye exercises. That is very important because we have muscles inside the eye. We call it ocular muscles. If you strengthen it, fine, and you get that spec. I don't remember that particular thing, but it is available in the market also. If you start wearing it, it gives you a little bit of exercise, make your eyeball exercise, fine. And in that way, you should not increase your. If you are having 4, let it be 4, fine. And if you work more, then it will go down a little bit. But if you don't take care, it will go on increasing. So I will advise you start exercising. Your eye exercise is very important. You consult your ophthalmologist for that. They will give you good eye exercise for that. And you meet them. It's possible. But it's early. In this age you try, it's possible. And many of the times you can reverse it back also with due course of time. But it is everyday affair. It's not that one day I will do and I will not do it. It's not that. Every day if you start working, It is a possibility.
Thank you, sir.
Sir, one
Anyone?
question from my side.
Yeah.
Sir, one question from my side. I'm Ravidas.
Uh-huh.
Sir, actually, I know since long, and we are so closely associated. Sir, this program, what you are telling, that education you are going to give, this education, I hope, Ravi Shankar is giving, Ramdev Baba is giving. Is it your same time or you have got something
No,
different?
that's what I tell you. One thing. What is
Yeah,
happening in this whole scenario? I've been researching in this field since last 7 years now. You know it very well. What is happening? People are. I told you in the beginning. Now people are now. Suppose I am a yoga guru. So I give my whole focus on the yoga. Yoga is a science. Try to understand this. Ramdev Baba is teaching yoga. He's a very good yoga instructor, no doubt about it. I don't have a question over it. But the way yoga has been taught to people, it is not at all acceptable. Fine, number one, because it's a science. Science has to be taught in the way it has to be taught, and people have to understand the physiological aspect of it. Until and unless you understand the physiology, you cannot teach, you cannot perform, and that is the reason why people are not getting the result. Where is the result? Result. We have been expecting a good, and I'll give you an example. Whenever Ramdev Baba goes to a town, and the next 3 months is a difficult time for doctors, because we see a lot of complications, and we are really we think what happened. 3 to 4 months, people are coming just like rampantly, vomiting, obstructions, bleeding, and you name a thing, they come with us. I have seen it. Practically speaking, this is what the practical thing I'm talking about. So it is. I don't blame, but they are teaching only yoga. Let's say Sri Sri is teaching about mind. Mind is one part of it. We have 4 pillars. I'm talking about a holistic approach. You should understand anatomy. You should understand physiology. You should understand the biochemistry. You should understand energy system. Who will teach you? Until there is someone who knows about the thing. And that is my aim, that I should produce one category of people who will teach all the things. They'll come with all the armament. They will have the full of armamentarium of knowledge. Fine. I don't say they are bad. They are good in their own field. That is very good. Somebody is talking about spirituality. So I don't talk spirituality in whole thing. I don't consider myself a spiritual person. I don't know why I don't feel. I feel if I do something for someone, it is a spirituality. Yeah, doing it for something, serving others is a spirituality. That is what the basic thing is. I don't have to. I pray. I do meditation every day. I practice everything which I have learned, but in a complete manner. I do exercise every day. I look into my food, nutrition. Everything has to be there. Otherwise, one thing will never keep you healthy. One thing will never keep you healthy. You have to understand the basics of your health. And that is what the need of the time. We doctors, we know a lot of things. We never come out. Nobody has got time to think about health. We know the anatomy, we know the physiology. When I had the problem, I started relearning the thing in that angle only. In the angle of disease, not in the angle of disease, in the angle of health. And health by itself is a science.
Thank you, sir. Actually, I'll just inform you. Recently, we had a program where I have presented your book to 2 principals, and thanks. All those 2 principals are there in the meeting today. They are listening you. At least after listening, I hope they can pass the knowledge to the students. And your books I have gone through very thoroughly.
Yes, sir.
And
Thank you.
I feel it is. I'm really proud that actually a person of Rautla has written this book.
Yeah.
It's global standard, sir.
Thank
It
you,
is
thank
global
you.
standard. Just like that, people will say, "Oh, yes, doctor has given it." Don't give anybody to in a free of cost, sir. If you give free of cost, the value of the books will go. I'll try my best to popularize, though it is already 3 years apart. But now, after going through the books, I have felt this is a book. This is a you can say it's a health Bible for all the people, all students. And if we can start it from the down class 1 level, it will reach up to the infinity. Thank you, sir. If you are getting a teacher of your standard, what you are planning, sir, please inform us. We can start the talk, because always after leaving your job, you cannot go for this talk. Your video will sufficient, but if anybody is trained on that, we can advise people to.
Yes,
Thank you, sir. Thank you for our talk, and thank you for your answer.
Thank you. Thank you.
Excuse me,
Yes.
sir.
Yeah.
Excuse me, sir.
Yes. So may I?
Yes, sure.
Yeah.
Switch on your
Yeah,
videos.
so-
I can't see who is talking.
Yeah.
Yes, sir.
Switch on the video.
Yeah.
Switch on the video. Yeah.
So this side Sindhuja. So I have a question for you. Is as you said that physical health is important. Yes, I do agree that physical health is really very much important. But with that, we have to prioritize our mental health also. So sometimes we face a situation where our surrounding is full of negative vibes and we start overthinking about certain topic and we want to get into that positive vibe once again. But at that moment, our brains start controlling us. So how can we get rid of it?
That's a very nice question. See, I tell you, we have chemicals in our body. I told you na, that I always, because this is very small. So what we do, sometimes we can manipulate our chemicals of our body. There is a hormone called serotonin. There is a chemical called serotonin. It's a happy hormone. How can we? Do you know 70% of your this thing is generated in your intestine? And when we exercise, fine, when we exercise, what happens? We generate another chemical called endorphin, which is a tolerance one. It reduces our pain and sensitivity. Fine, serotonin, then this endorphin. These are the chemicals. So you know, the moment you are physically active, the problem is that now we are physically not active. Our battery are not charging. We are not charging our batteries. I told you very simple thing. So go on charging your batteries. Be charged. See, nothing will, your environment will, that is why I told you, our environment is so toxic nowadays. You look, open up your television, do the newspaper, and I'll tell you, in my bedroom, there is no TV. For last 20 years, I've never watched a single news. I don't know what's happening in the world. In the morning, I see only headlines. I don't bother. I don't bother what's happening. What should I know? If somebody is a prime minister or somebody is a war, what should I know? These are negativity. And every time they are programming our mind. They are programming the whole situation. So the whole conspiracy is to program our mind. The advertisement you see, the movie you see, they are programming. So maybe it's not possible to do in a great extent, but to some extent it is under your control. Right? You change your environment. The moment you see there is a problem, and I'll give you a simple formula. There's a couple of counting 5. Count 5 and go away from that place. Leave that place. You don't have to fight. You don't have to be there. You don't have to receive them. Don't allow them to touch you. They should touch and deflect. It should not enter your heart. Here, that you should not allow anything here. It's a very special place. So you should not allow anything to touch here. Fine? The moment you do that, you will be out. You will start working on yourself. Don't blame the situation is like that. Because everything revolves around you, and you. Fine? The moment you start loving yourself, the moment you start thinking about yourself, you will do everything for you. You don't bother for that. Nothing will touch you. Fine? You can work in that.
Yeah, so thank you, sir. So one more question I do have related to that only.
Yeah.
So one of my friends want to become a music therapist. So is music therapy is really important to get rid of mental health? Like if we are suffering from negative vibes.
Yeah, it is.
Is
working.
it really helpful?
It is working. See, music is what? It's a frequency.
Right.
Try to understand. Music is what? Music is a frequency. And what are we? Do you know that? What are we? Let me tell you. What are we? We are, if you go to the smallest particle of our body is our cells. And cells go, then you break it up, then you go to the molecules. And when the molecules, then you go to the atoms. Fine? And the scientists went into the see that what is there inside the atom. So we have an atomic microscope. You must have heard about that. Fine? And they started looking into the atom. What are their things that we are made up of? Because the table, the chair, you, me, everybody is made up of atoms only. And now when they looked into the structure, they found there is a blank. Nothing is there. Only they found there are certain particles moving in different frequencies. And these are all waves. So ultimately, we are waves. We are frequencies. Your frequency and your friend's frequency. Why? Suppose, I'll give you an example. Everybody must have felt. The moment you meet somebody, new person, some people who feel you are very good. Edwin is a very good person. You feel it. And he must have opened his mouth. And some person, the moment you see them, you find negativity. You don't find he is not a good person. What is that? Because the person whom you feel good, their frequency, your frequency are matching. Our frequency generate in around 25 meters of radius. In yogis and all these things you called aura, What is that aura? Aura is the frequency which we generate. Try to understand. This aura is there. So I have a different aura, you have a different aura. So, and the table is there. Table and us, a difference is the frequency of the matching. Right? It vibrates in different frequency, we vibrate different frequency. So music is a frequency. So when we resonate with that frequency, naturally our body cells automatically atomic level will be improving, and that will again take you to a healthier one. That is what is the difference. So it will help. I encourage. I don't say no. It is
Thank you,
music
sir.
also helps, but you have to understand that basic physiology.
Right, sir. Okay. Thank you so much, sir.
Ravi,
May I ask a question, sir?
Yeah.
This
Sir,
is the last. Aniket, I think this should be the last question.
Sure, sir.
Okay. Please carry on.
Sir, when you were telling about mental self-care, you asked us to embrace our stress and to enjoy self-care and not force it down on us. So how do we actually practice that?
How do you practice that? It's a very
Yes,
big
sir.
thing because it takes me 3 hours to explain people, I have to go through stories. There are a lot of stories. I'll tell you one example then that. How embracing stress helps us. What are the experiments done? I'll tell you. So what they did, they there was a study done in 7 big hotels. Fine. They made it 2 groups of hotels. They took the employee of those hotels, and they found everybody got some hypertension. They're not mentally healthy. So what they did, they made it 2 groups. In one group, they told whatever you are doing, because previously before the study, they all were in stress. Right? They are thinking they are doing a lot of work and they are overworked and everything they are doing. So these people are given. So they, after the study group has been made, the one group they told that they advise everything like I'm advising you, that you do this thing, you do meditation, you do this thing, your stress will go and this and that. All the good advices have been given, and they're given cassettes and everything to listen. The second group of people, they told that okay, you are doing bed making. Your bed making is causing you are spending around 300 calories in bed making. Sweeping, you are spending just 300 calories. So they are putting the calories value of each work to those people. And so they told, see, every day you are exercising and you are consuming this much of energy. So you are doing just like an exercise. Now these people thought, oh, we are doing exercise. That is very good. After 3 months, they bought all the people, they started studying them. They found this group, which has been advised only, they were same. They never changed. And the people who have done this thing, they have started the same thing, but they have now started in a different way. They started embracing this. They started thinking this is doing good to them. Fine. And those people, everything changed. They're physical, they've lost weight, they are healthy, they are not, their behavior changed, everything was different. So what they did is, this stress was there, the same thing is there. We cannot change our stress level. If somebody tells, I'll manage your stress, it is not correct. You cannot manage your stress. We have to have stress. You in study, you will have stress. During my operation, I'll have stress. Some little bit of stress is good. It is good. It's positive. It is. So what we have to do? We have to embrace. We have to think. This thing is going, like those people thought, doing this is helping me. Now they've embraced the thing and they've improved. So you have to find out your own way of embracing this thing. You have to take it positively. Okay, this will come. I'll put my foot over there and I'll jump. I'll go higher. So you have to find out your own way of doing it. Right? Thank you.
Thank you so much, sir.
Thank you. Thank you.
The guest, please propose a hearty vote of thanks and adjourn the meeting.
Yes, sir. Now I would like to ask Sindhuja to present her vote of thanks. Sindhuja, please.
Yeah, sure. I, the Secretary of Rotary Interact Club of Rourkela, Sindhuja Monty, on behalf of everyone, would like to take a moment to present my vote of thanks to our respected dignitaries. First of all, I really want to thank the Rotary Club of Rourkela to bring this golden opportunity for us. I am obliged and grateful towards Dr. Biswajit Mahapatra, who gave us such a vast knowledge about our own health, and for sure we will follow it. I also thank the President of Rotary Club of Rourkela, Mr. R. Kiran, Mr. Ravidas, and Mr. Biswajit Pati, and all the esteemed Rotarians. I also thank Mrs. Sashmita Mahapatra ma'am, who is not present here, but without her immense involvement, we are nothing. So lastly, I thank all the students for being the part of this meeting. Thank you so much.
And he gets adjourn the meeting.
Okay, thank you.
Thank you, sir.
Thank you.
Thank you, sir. Sorry for the very low attendance, but hopefully, definitely.
It's all right. It's all right. And I think the one person can benefit is also
Sure.
this thing. But I believe in that. I told you now. Thank you very much.
you.